Well, so glad to see so many of you back today. We get to dive into the topic of program administration, and we will just take a quick moment. I always like to do some reflecting back as I prepare presentations. These are just two different pieces of time. One historically was an event that we did here locally to raise money for the American Cancer Society. And then another was with a small group of my Living Beyond Cancer participants. We were rallying behind raising funds here for a financial aid fundraiser. So we always get into we always get into that topic of, what keeps people coming back. And so these are certainly some of those ways in which, you can see that people are celebrating and having fun while they participate in exercise. So go ahead and next slide, please. So as many of you are probably aware, cancer rehab should be conducted and trained by certified, exercise specialists and or trainers. I always feel that it's important as professionals who work with this population that you're not only aware of the types of cancer, but also the types of cancer treatments, in addition to how those side effects, how the and treatment and the side effects of the cancer and its treatments can have on those who you work with. Generally, we individualize the program for every cancer survivor to just ensure a quality of care. When we look at kind of the steps that one would take in terms of program administration, there's 4 areas. There's what we would call the needs assessment, program development, program implementation, and also program evaluation. So we're going to discuss each of those areas. And we're going to start here with the needs assessment. So what we want to ensure that we do is surveying the needs of the cancer patient and the survivor population. And I can speak to my personal experience with PALS 8 years ago. A patient came and was wanting to do training, and we were trying to discuss if there were any other opportunities, within the Dartmouth-Hitchcock community for her to reach out to, right? So rather than just doing one-on-one personal training, my goal was to kind of find this socialization and group for her, but it didn't exist. So right there, we figured a need, right? And at that point, this individual was really in wanting to feel like she was doing something to give back. And so we started to write letters to the Dartmouth-Hitchcock community to see and assess, is there a need for a breast cancer survivorship group, right? And so so I think that it's just always important to look at the needs of your area. So if you're wanting to start a new program, look to the community to see what's already being offered so that you can either improve upon what's happening already or start anew. Figuring out what the needs of the community are. Does a facility want to offer classes in your area? Because often facilities like mine, like a local YMCA or a nonprofit, are very much, in a position to do something of that nature and find supply or, work with you in order to supply grant funding. Then the next step would be to market surveys, right? Participant surveys, focus groups, any current community program evaluations, and looking at, other local organization databases. That might be like the American Cancer Society or other local YMCA programs. So we always start by assessing what's going on in our community and what's going on with the needs of the patient who's come to you. So next slide. This just goes into some detail about organizational structure. And this is what it could look like. And this structure encompasses both leadership and management. Grace and I were talking actually earlier today, because we gave ourselves a little bit of a chuckle, that this organizational structure doesn't really apply to the programs that we do here at the Aquatic Center, because my name would be probably in every one of those blocks. We don't have the funds or the means or the ability to have all of these different pieces, but certainly from a clinical perspective, you could. But that's there for you to see. Next slide. So then we talk about, of course, program development. And we always want to start with a mission statement. An example of a good mission statement would say something to the extent of, advancing the quality of life of cancer survivors during and following cancer treatment through prescriptive exercise rehabilitation. And from the mission statement, of course, we create goals. And those goals could be something similar to, whoops, sorry, I've got to pull something up here. 1 second, I just messed myself up on my screen here. What'd I do? Sorry, hold on 1 second. Well, thanks for bearing with me here 1 second. All right. So as far as goals are considered, you might do something to the extent of wanting to educate survivors on lymphedema, right, and or nutrition. An example of this also could be that you want to provide scientifically based exercise prescription. As far as your objectives are concerned, those might be a little bit something different and encompass, preparing a brochure that defines the services that you're offering. I've gone ahead and I'll have Megan go ahead and connect. I brought up our program here at UVAC just for you to look at. So if you want to go ahead and click in for me, Megan, we will just kind of quickly jump to UVAC's home webpage. Whoop.
1 minute, just getting it up.
Sorry. But what you'll see, and this will be a good resource for you guys to check out, I'll show you a little bit more about what we do here at the Aquatic Center. But within the first few lines, of course, you can see our established mission statement that we have and that we allow, that we want people to read. So I'll just have you go ahead and scroll down. It's going to be on the left-hand side, Megan. So you're going to see, who is PALS for? And we state right away that the Upper Valley Aquatic Center wants PALS for Life to bring safe and effective research-based exercise to as many breast cancer survivors as possible. We welcome anybody who's been affected by breast cancer, and that all survivors are encouraged to stay active, and strength training, if performed correctly with proper guidelines, is very safe and extremely beneficial for those who have or may be at risk for lymphedema. So, we established that right out of the gate on our website to really embrace what we're all about. Thanks, Megan. You can kind of go back right now to the slides. All right. And we'll go ahead and do next slide. Perfect. So the next part, of course, would be to start to talk about choosing your program's components. And we used a different resource for this. We went to Rocky Mountain Cancer Center. Some of you may or may not be familiar with that institution. But they have a very progressive part of their program development. And they have established 7 components, which includes screening, a physical exam, a physiological and psychological assessment, as well as reassessment and prescription, dietary evaluation, individualized prescriptive exercise interventions, as well as basic and clinical research, advanced education and professional development to promote, a high standard in cancer rehab. So this is a very specific approach, and what you'll need to reflect on is what components of your program, and they'll be based, of course, on that needs assessment that we kicked things off with, right? So who in the community are you, going to be developing this program for, and, and or with what facility and kind of working tools that you have. I think it might be actually next week, we're going to be reviewing PALS specifically, and we'll have an opportunity to go more in depth with that. But we left the link so you guys can kind of go back and just kind of see, because they're a great resource for some good information. Next slide. Terrific. And some other preparations that you certainly want to be thinking about in terms of program development. Budgeting, that is a big one. Employee salaries and or benefits that they, you're going to be responsible for, as well as, equipment and materials. And then of course, marketing. And we just, for fun, added a quick PDF here of some of the marketing we do at the Aquatic Center. Also program pricing. What is the number of participants that you need to break even? We work really hard at the Aquatic Center to provide 6 months of programming at no charge to all of our cancer survivors. And that's quite a feat, because we have to do a lot of grant writing and find, local community support to help us with that. But we do find that it is a barrier for a lot of people. And so offering them the opportunity to come to our facility and get the benefit of the facility as a whole, in addition to my expertise, has been really valuable. And then of course, developing a marketing plan. So go ahead, next slide. And then we get into, of course, cancer rehab programs and settings. So there's always factors that you want to think about. The convenience of the facility location. I know one thing that we spent a lot of time with when developing our program was, did we really want to have a cancer survivorship program happen within the facility that people received treatment? And more often than not, the people that we polled and spoke with were they had a higher preference of kind of meeting outside of that building and starting to create some new experiences. But again, it all depends. If you don't have space and there's space available through a facility like a hospital, then it's a great opportunity. But scheduling, having lack of conflicts and other community programming, kind of weighing in on different times or prime times when you want to be offering programs. Also thinking about liability waivers, the number of program participants in relationship to staff available. And then of course, the type of staff that you have that are going to be facilitating these programs, whether it's PTs, exercise specialists, and or personal trainers. Next slide. So from there we go kind of more into program implementation. And our goal is to create a program that meets improved psychological and physiological performance, and that also gets a high level of attendance. We really look to ensure that our programs are thriving because they are grant funded. We always want to be making sure that when we rewrite our folks that support these programs, that we can give them those statistics that are saying that we are having more and more involvement and people are having that stick-to-itiveness of continuing throughout our paradigm of offerings. But some ideas about what's important when you get started is to develop perhaps a cancer survivor chart. And I always think that this should be developed right at the beginning because it really does help you to collect important information. And the chart can include lots of things, but things that I find most valuable are like a problems list. When an individual comes in, what are their barriers to success? And then we also speak really in detail to their cancer history, as well as more of their both subjective and objective data in terms of their medical history, because often there's things that are significant that might have happened 10 years ago or even 15 years ago when I'm thinking about putting together programming for them. Any exercise prescription that they've had to date, and some correspondence. We really look to communicate well with our providers here in the Upper Valley. So lots of, information from their current PT or oncologist, other people they might have been seeing in the interim. Other items that are sometimes helpful when creating a survivor chart is the Piper fatigue scale. So Megan, I'll have you just click on that. And maybe this is something that you're familiar with already, but we find this as a really good tool to kind of kick things off with. And often we do these fatigue scales on a weekly basis, but I'm going to have her pop that up when she has a second. Perfect. Awesome. So if you're not familiar with it, is going to give us a sense of whether they're experiencing more or unusual excessive tiredness, when they're receiving treatment or recovering from an illness. So I think there's 10 questions on this, but it's an opportunity for us to kind of, again, baseline test and then see how things are week to week, and then kind of get an assessment over 12 weeks. The other scale that I put in here, just that I think that's important to reference, would be like the Beck scale. And so Megan, if you have an opportunity, I'll have you scoot to the Beck scale next. Great. And Beck is more specific on, it's a depression inventory, which I think is a really important thing to be following as people are engaging in this new territory, because often I see a shift with their emotional well-being as they progress through working on themselves during this time. So in terms of program implementation, those are some ideas for a cancer survivorship chart that might be helpful. We'll go ahead and go to the next slide, Megan. Doing some really thorough health screening and assessments. And I touched on this a little bit, but the cancer history, the medical family history, as well as a risk factor analysis. Lifestyle evaluations, I think, always really important. The quality of life index, getting a sense of their dietary, kind of currently, like what they're getting in terms of support, what they need help on, and then performing, this is where I kind of do a lot of my work, the fitness and nutritional assessments as a whole. So really focusing on, cardiovascular stability and strength testing, as well as muscular strength testing, body composition, flexibility, and kind of, again, giving them a really solid baseline to see how far they've come in a short amount of time. From there, we're going to go to the next slide, Megan. Regardless of the facility that you work at or you choose to work in, it's really critical that there is a strong, well-designed operational plan. This is just a list to guide you for things to think about when planning. So I've just kind of listed everything here that I think is really important. And you guys can certainly reference this, after today's presentation, if you're in the midst of actually creating your own programs at this point. Next slide. Some other things to really familiarize yourself with are, of course, policies and procedures. The standards that, fitness facilities use should also be, standards for cancer rehab facilities, and kind of finding and making sure that they're linking up. We've have ACSM's guideline there for you to reference post our session. Also, really kind of jumping into legal issues and documentations, making sure that there's a development of some sort of manual to support you if you're doing this independently, as opposed to working with another organization and aligning kind of those issues. Community-based support is, so important when you're developing your own programs. It's been vital for me and my success over 7 years. I will jump at any and every opportunity to, do outreach to help support and increase both awareness, but also positive attitudes about what I am aspiring to contribute to the community. We get a significant amount of referrals from both physical therapists and oncologists at Dartmouth-Hitchcock. And our programs are, advertised both in local newspapers as well as newsletters. And I'm frequently called upon to, of course, make presentations, both at Dartmouth, when they do, specific kind of cancer outreach, which is really wonderful because, again, it presents me with this opportunity to kind of have people learn more about our programming and how it can both help them and people that they know. And then there's always the topic about reimbursement concerns. So when you're talking about program development, most of these programs, cancer rehab, were not recognized by insurance companies, and that can make it really difficult. I spent the first almost 3 years doing PALS in kind, just because I wanted to. I love the people I work with. I was committed to the cause. I was committed to making a difference. And by year 3, my initial 2 to 4 hours a week became 15 hours a week, right? And so it was clear at that point that I needed to really establish some continuum of funding for myself to be able to progress and move forward. But you may need to work with, of course, your network, like DHMC or whoever your cancer treatment facilities are, to help with reimbursement. There are lots of grants available, and that's something that I can speak to. So if you're somebody who's really desiring to do some program development and don't know where to start, I'd be really happy to talk to you about what I think works well, and certainly where I feel like are good places to start to resource some of that financial aid for you to get started and kind of jumpstart your programs. Next slide. Great. So that leads us, of course, to program evaluation. And there are 2 parts to ensuring that I think that are important. First is the process evaluation. And that would really speak to kind of what are we doing, when, where, how much, are we on track for resources? So it helps to evaluate the effectiveness of the program, so that appropriate adjustments can be made. We also get, of course, data from staff and participants using survey questions so that we can really fine-tune our processes. And then the other is, of course, is the outcome piece. And with an outcome evaluation, it would be more like, did we achieve our outcomes, right? What can we learn from the participants who've dropped out of our program? So starting to ask some of those really tough questions to help us understand our program results. We like to, of course, get that data collection by program staff to help support future rollouts of the same program and or initial funding requests that we have. But evaluating your program is critical, and so finding a system to do that, I think, is really important. We're going to give you an example. Go ahead and go to the next slide. This is just a quick sample template of an outcome evaluation plan where you kind of start with that overarching program goal. And like with PALS, it's similar, provide a scientifically based, individualized prescriptive exercise intervention for cancer survivors. What's the target outcome? That we see 85% improvement of physical performance. What are our steps to do this? They're offered a comprehensive individualized 3-month exercise intervention, right? And then the results, we're gonna do those pre and post fitness assessments, right? And through those, we'll be able to see those baseline improvements. The one example here is talking to, of course, VO2 capacity, improved oxygen consumption. But it can be a run walk test, right? It can be a variety of things. It can be a wall sit. There's a whole way of examining those tools. Creating an analysis and action plan. So where can the program be strengthened when we learn? And then always, having someone responsible for doing this so that it ensures that it gets completed. And I think that's actually really it. You can kind of go to the next slide. It's just a quick reference slide. So, the idea here is that we're just trying to open the door to really start about how to administrate programs. And I'd love to start to engage in a dialogue and some questions from you guys. So.
Thanks, Erin.